So welcome to the second session of the course, which is about medicine, health, and neuroscience. So first, neurocare will be sharing about physical health and mental health. So let's pass the mic to neurocare.
Okay. Hi, everyone. We're Neurocare Ed, a student-led organization based in Canada.
So to introduce ourselves, hi, my name is Simran.
My name is Ada.
My name is Tasia.
Oh. Technical issues.
Your mic is muted. Sanvi, your mic working?
Hello.
Oh, I'm sorry. And I'm Sanvi.
Our goal is to educate youth on the importance of both physical and mental brain health, which is exactly what we're going to discuss today.
Just as a rundown on what we will be covering, today I will start off by introducing mental brain health.
After that, I'll teach you about the physical brain health of your brain and its general significance and the various parts of your brain.
Then I'm going to discuss how mental brain health and physical brain health are intertwined.
Finally, I'll present you a case on epilepsy, a perfect example of both mental brain health and physical brain health. So let's get started. First off, mental brain health. Well, what is it? Mental brain health refers to a person's emotional, psychological, and social well-being. It affects how a person feels, thinks, and acts, and determines how we handle stress, make ethical decisions, and relate to other people's feelings. Mental brain health is a huge part of our body's development and is constantly developing and changing from childhood all the way to adulthood. Now, there are some signs of mental health declines that we need to look out for in order to keep our bodies functioning properly. These signs include the inability to perform daily tasks, such as getting out of bed, eating proper food, etc. Constant and drastic mood swings, whether that be heavy anger issues, anxiety, fluctuating emotions throughout the day, and so on. Social withdrawals, when you feel like you don't want to participate in any social gatherings or activities. Difficulty concentrating on the tasks at hand, loss of previously enjoyed activities, increased feelings of sadness, nervousness, or anxiety. All of these symptoms could possibly hint towards different mental health issues and could cause possible states of deep depression. Now, moving on, how can we promote our mental brain health in order to keep it from declining? Well, there are numerous ways to promote our brain health. However, I'm going to share a few with you. Number one, practicing self-care. Taking time out of your day to take care of yourself is extremely important in promoting your mental well-being, such as going for a walk, reading a book, taking a bath. You can do any of these activities to promote your mental health. Next, fostering a good nutrition. It's important to have a healthy and balanced diet in order for your brain to function properly. You can do this by eating a variety of fruits and vegetables, including sources of omega-3 fatty acids such as fish, berries, avocados, nuts, and many more, and avoiding excessive consumption of alcohol or caffeine. Remember, various colors in your food means good things. Moving forward, using your technology wisely. Technology and social media can be a very mentally draining platform, so it's very crucial to use it with precautions. These could include limiting your screen time on social media, or at least setting specific times to check them once in a while, and practicing regular digital detoxes. Finally, last but not least, spending time with other people. Humans are created to be social creatures, and they thrive from strong relationships. So, making time to spend with those that you love is very important in promoting your mental well being. To conclude, it's important to understand that our human bodies need stable mental health in order to function to the best of their ability. Many people recognize that physical brain health is very important, but some people neglect the fact that mental brain health is important as well, even though it plays a huge role in our personal well being. Make sure to always keep an eye out for any warning signs of mental decline and constantly practice the numerous ways to promote your mental health well-being.
Okay, now discussing physical brain health. Different parts of our brain, the different diseases it can have. Our brain is a vital organ that controls our thoughts, emotions, and movements. It's time to explore why it's crucial to take care of our brains and understand the various diseases that can affect it. The brain is divided into several regions, each with its own unique functions. Here are key parts of our brain. The cerebrum. This is the largest part of the brain and is responsible for conscious thought, memory, language, and sensory perception. Then you have your cerebellum. Located at the back of your brain, the cerebellum controls coordination, balance, and fine motor skills. Then you have your brainstem. The brainstem connects the brain to the spinal cord and regulates basic functions like breathing, heart rate, and blood pressure. After that, you have your hippocampus. The structure plays a crucial role in forming and storing memory. Then you have your amygdala. The amygdala is involved in processing emotions, especially fear and aggression. Unfortunately, the brain is susceptible to various diseases that can impact its function. Let's explore some common brain diseases. Alzheimer's disease. This progressive neurodegenerative disease affects memory, thinking, and behavior. It is characterized by the accumulation of abnormal protein plaques in the brain. Then we have Parkinson's disease. Parkinson's affects movements and is caused by the loss of dopamine production cells in the brain. Symptoms include tremors, stiffness, and difficulty with balance and coordination. Stroke. A stroke occurs when blood flow in the brain is disrupted, leading to brain cell damage. It can result in various impairments, such as paralysis, speech difficulties, and memory problems. Maintaining physical brain health is crucial for overall well-being. Here are some reasons why. Cognitive function. Regular physical activities has been shown to improve cognitive function, including memory, problem-solving, and learning abilities. Mental health. Physical activity can reduce the risk of anxiety and depression, promoting emotional well-being. Disease prevention. Engaging in physical activity can lower the risks of cognitive decline and diseases like dementia. Cardiovascular health. Taking care of your heart health through exercise and a healthy diet can also benefit your brain, as cardiovascular health is closely linked to our brain health. Now, here are some ways we can maintain our physical brain health. Maintaining a healthy lifestyle. A healthy diet, ample sleep, and relaxation, along with control of vascular risk factors, are considered important for your brain health. Stay mentally active. Engage in activities that challenge your brain, such as puzzles, reading, or learning new skills. And seeking medical advice is very important. If you notice any change in your cognitive function or experience symptoms related to brain health, it's important to consult a healthcare professional. In conclusion, physical brain health is crucial for overall well-being. By engaging in regular physical activity, maintaining a healthy lifestyle, and staying mentally active, we can promote brain health and reduce the risk of neurological disorders. Remember, taking care of our brain is just as important as taking care of our body. Bringing it on to Simran.
So now that we have learned both about mental and physical brain health, it's important to know how they're interrelated. So how do they impact one another? Let's look at an example. The simple diagnosis of a mental illness is related to physical brain health, but how? Well, scientists have learned that mental illnesses are associated with and/or are caused by changes in the brain structure, chemistry, and function. Mental illnesses are related with physical brain health as they have a biological basis. And this is a great example of how the physical aspects of the brain and mental aspects of the brain are very much interrelated. And as mentioned before, we also said that we should engage in physical activity like exercise to improve physical brain health. But isn't that also said to improve mental brain health? Well, exercise causes your brain to release endorphins and serotonin, aka feel-good chemicals, which can improve mood, can do things like help pull away from negative thought patterns. And this is an amazing example of how we don't even realize how helping one part of the brain is so helpful to the other part of the brain as well. So let's look at some how bad mental health affects physical brain health. So as mentioned before, mental illnesses are directly related to the biology of the brain. In cases of mental illnesses like depression, it's actually not unusual to face headaches and migraines. which is very much caused because of the mental health. So now you're having effects on your physical brain health. As discussed before, your brain and its physical health is also connected and related to all aspects of the body, which means that your mental health is also related to all aspects of your body. For example, when you're stressed, your body releases the hormone cortisol, which can cause spikes in blood pressure and heart rate. Over time, chronic stress or excessive stress can actually cause depression, anxiety, or PTSD, and that could actually increase your risk of developing heart disease. Did you just see how chronic stress ended up being very much related to heart disease? It's a very great example of how the two are interrelated. It's also known that chronic stress or depression can cause fatigue or lack of energy, therefore affecting your ability to get a sound sleep. Eventually, this can cause sleep disorders, including insomnia or sleep apnea, another great example. So how does bad physical brain health affect mental health? Well, similarly, all the scenarios presented before can actually be flipped around just the other way to see how the effects can go vice versa. But I'll give you an example. For example, in a situation where one is not physically healthy, perhaps they have a physical illness or they're just not having the greatest physical brain health, feelings of social isolation and stress may arise. And these thoughts can eventually lead to chronic stress or anxiety, which can progress into something much more, as mentioned before. So that's how an example of just how the situation can be flipped. Here are some interesting facts that are very much related to how mental brain health can affect physical brain health and vice versa. So people with diabetes are 2 to 3 times more likely to be diagnosed with depression and 20% more likely to experience anxiety than those without diabetes. Another one is that people with chronic respiratory diseases like chronic obstructive pulmonary disease, bronchitis, or asthma are more likely to report symptoms of depression. And depression is the second most common self-reported comorbidity among people living with COPD. And another fact is the risk of depression, anxiety, or developing a sleep disorder is higher for those with psoriasis than those without. So what's the point that I'm trying to get at here? What am I trying to tell you? Well, let's use this analogy. Your brain is kind of like a group project. If one person isn't doing their job properly, the entire group is affected because the others can't pull the load of that one person. Similarly, if we don't take care of both our mental and physical brain health properly, we will face repercussions because if one isn't taken care of, the other is let down. Another great analogy is a handshake. Both people have to participate properly for it to even work. We need to take care of our physical and mental brain health equally, making sure we don't neglect either to ensure our bodies function properly. Now passing it on to Sanvi.
So I'm going to be talking about epilepsy. What is epilepsy? Epilepsy is a neurological condition that causes recurring seizures. A seizure is defined as a sudden alteration of behavior due to temporary change in the electrical functioning of the brain. Let's talk about mental health. Let's talk about the mental brain health aspect of epilepsy. Some signs or symptoms are cognitive impairments such as memory problems, attention defects, and language difficulties, emotional disturbances, including depression, anxiety, and mood swings, and psychiatric comorbidities like schizophrenia or bipolar disorder may be associated. Let's continue with physical brain health aspect of epilepsy. Some physical brain health symptoms or signs are abnormal electrical activity in the brain, hence seizures, structural abnormalities such as tumors, strokes, or traumatic brain injuries, neuroinflammation, which is the inflammation of the brain, and genetic factors. If one is diagnosed with epilepsy, they can perform relaxing activities such as yogas, massages, and acupressure, perform medical adherence by taking doses according to their healthcare providers and not skipping doses because it can increase their symptoms, identifying triggers that especially affect them. Potential triggers that may lead to seizures are lack of sleep, stress, alcohol, or specific foods. So by avoiding or minimizing exposure to these triggers, they can help reduce seizure frequency. Establish a healthy lifestyle with balanced diet, get regular exercise, prioritize sleep hygiene, and maintain stress. Also, take safety precautions to minimize the risk of injury during a seizure by using padded furniture, avoiding sharp objects, and wearing helmets during activities that carry a risk of head injury. One can wear devices which can notify their caregivers or loved ones in the event of a seizure and provide an added layer of safety and support. and perform regular medical monitoring by attending regular appointments and adjusting medications as needed.
So that's it for today. Thank you so much for listening to us, and we hope you guys learned something.
So thank you, NeuroCare, for your sharing. Could you please unshare the screen? Okay, thank you. So now I will be talking about how drugs impact the nervous system. Okay, so drugs can disrupt the normal communication between neurons by either mimicking natural neurotransmitters and activating neurons, or by causing neurons to release unusually high amounts of neurotransmitters. In both cases, these drugs interfere with the way neurons send, receive, and process signals, leading to abnormal messages being sent throughout the networks. So you might be wondering, which parts of the nervous system are affected when people take an unreasonable amount of drugs, or basically misuse drugs? So 3 parts of the brain are mainly affected by the consumption of drugs. The first one is the basal ganglia, which plays an important role in positive forms of motivation. This includes the pleasurable effects of healthy activities like eating, socializing, and sex, and are also involved in the formation of habits and routines. Second is the extended amygdala, which plays a role in stressful feelings such as anxiety, irritability, and unease. It accounts for motivation to seek the drug again. Extended amygdala becomes increasingly sensitive with increased drug use. Over time, a person with substance use disorder uses drugs to get temporary relief from these discomforts rather than getting high. And third, the prefrontal cortex. It powers the ability to think, plan, solve problems, make decisions, and exert self-control over impulses. Since this is also the last part of the brain to mature, teenagers are the most vulnerable. So here are the explanation to some of the vocabulary item mentioned in the previous page that you may not understand. The first one is high. In the context of consumption of drugs, its high refers to the feeling that drug users want to get when they take drugs. This includes a very happy or spacey feeling, or a feeling that someone has special powers, such as the ability to fly or to see into the future. Second, euphoria. It refers to a feelings of extreme happiness or confidence. This is what people believe that they feel after taking drugs. It is also an example of being high. Third, neurotransmitters. Our body are full of neurotransmitters, and they are basically the body's chemical messengers, which carry messages from one nerve cell across a space to the next nerve, muscle, or gland cells. It is like the messenger in our body who passes different message throughout the nervous system. So here you could refer to the picture which shows where the 3 parts mainly affected by drug uses are. It is worth noticing that drugs can alter important brain areas that are necessary for life-sustaining functions and can drive the compulsive drug use that marks addiction. To a further extent, Taking drugs can also lead to different kinds of brain disease. The first one is dementia. It affects our expressive and receptive language abilities, attention and concentration, the ability to make judgments and plans, as well as visual, spatial abilities. Not only do taking drugs lead to dementia, but it also leads to seizures. What is seizures? It is something associated with thinking, movement, and bodily control. Seizures result from changes in the electrical activity in the brain and produce different kinds of issues. These are some of the examples of other diseases related to our brain which are due to drug misuse. They include strokes, or in other words, cerebrovascular accidents, ataxia, which refers to the condition that affects coordination or body movements in an individual, as well as liver damage. As seen in the graphic, it first starts with brain damage that is associated with altered mental states, followed by hypoxia, which in other words, significantly decreased levels of oxygen in the brain. So basically, these three symptoms are interconnected. So when you have one disease, you may subsequently have liver damage. So you might be wondering, why do we have to study the brain? It's mentioned in the previous page. Our brain is actually linked to many types of diseases, sorry for the wrong spelling, and it is not only associated with so-called brain disease, but it also is related to vascular diseases, degenerative diseases, inflammation, malnutrition and vitamin deficiencies, and even our mental health like neurocare has mentioned. The second reason that many scientists study and investigate the brain is that the brain is really complex. It is a complex and fascinating organ that should be taken care of from the time and utero to the life you live today and beyond. Basically, our brain is very mysterious and there are many mysteries yet to be discovered. Our brain is also a valuable organ in our body due to its multifaceted functions. Our brain underlies our ability to communicate, make decisions, problem solve, and live a productive and useful life. So now head on to our quiz, but since our meeting will have to end in 10 minutes, it will be better for us to leave the Zoom meeting and re-enter it so that we can have enough time for the quiz. So I'm going to stop the meeting now and then please enter the same code and meeting information to join the meeting again for the next section. Thank you. Okay. So I'm going to also share my screen. And now we are going to start the game. There will be 10 questions and each question amounts for 1 point. The first question is, which part of the brain controls coordination and balance? And the correct answer is the cerebellum. So moving on to the next question. What is the common symptom of the disease? This disease is actually related to our memory loss. Congratulations on getting correct. As mentioned by neurocare, some potential triggers include stress and lack of sleep. So to cope with epilepsy, it is important to identify triggers and avoid them. Avoiding all physical activity will basically lead to other kind of diseases and is not healthy for our body overall. Whereas engaging in stressful situations can actually make us feel anxious and tired. So it is not a really good way for us to kind of be more healthy and to activate the brain. So basically, like I've mentioned, euphoria is related to the feeling of intense happiness and also confidence. It is not a mental health disorder, as it is basically a condition and feeling. So this comes to the sixth question. What are the emotions disturbance associated with this disease and symptom? So when we have epilepsy, basically we will face anxiety and mood swings. So I've mentioned that this kind of effect is related to the basal ganglia. So moving on to the next question. What are the wearable devices that help individuals? So the wearable devices are responsible for notifying caregivers in the event of a seizure. So for example, when somebody has seizure, the family members with the will be notified if the patients have wear a wearable device. How to exercise impacts mental health. This is a multiple choice question, meaning that you may have to select more than one options. So the correct answer is that they are free. First, it releases euphoria as after exercising, we will be more delighted and like more satisfied and happy. And also it will give out serotonin and also endorphins like Neurocare has mentioned. So this is a poll and it is also a feedback you can give us. Okay, so wait a sec. Because it's somewhat loaded. Sorry. Okay, so thanks for your patience and now it's wait. Okay, sorry, I will stop sharing. Okay. So thanks so much for joining this session. And here are the winners of today's game. I will stop sharing now and thank you for joining this session. If you have any feedback, please DM me now in the Zoom chat. Or you could also leave the meeting now. Thank you for joining today and see you in the next section which will be in April.